So what decreases healthy gut bacteria? So medications, antibiotics are a big one. NSAIDs like Advil, Motrin, we talked about that. Oral contraceptives, birth control, radically decreases your gut bugs. Proton,
and they increase the incidence of depression.
yeah.
40%.
Because it decreases serotonin too, and B vitamins. So if you're taking oral contraceptives, we don't want unwanted pregnancies, especially with younger populations. What we do want you to do is pay attention. So because usually you start to feel a little funky and foggy. So what we want you to do is pay attention, B vitamins, and know that your serotonin is dropping. So do things to counterbalance that. Proton pump inhibitors. That is what we were talking about with your antacids, yeah. And steroids, and then as we just said, stress. So there's not a job more stressful than yours. But also things like really intense workouts. So athletes that are like high intensity athletes. Most police officers that I've known do really intense workouts. So recovery becomes really important for you guys. So recovering on your day off, and I know that I've heard that drinking a lot of alcohol on days off can be a common thing. But what you want to be thinking is, how can I recover and really nourish my body and get back to that homeostasis, that balance, right? Because that's really important. Sugar intake is terrible for your gut. Artificial sweeteners, so that's crazy, especially the yellow packet. So you want to be thinking sucralose actually really decreases gut bacteria, like dramatically.
So how was it designed? It was actually first developed as a pesticide.
Yeah, it's fantastic for
But
you
someone
if you want to kill
by
ants.
accident tasted it, and it tasted sweet. And there's one study that the company that makes Splenda just went crazy over. They gave it to rats, and what they found, it decreased healthy gut bacteria by 50%. And when Splenda first came out, I didn't know better. I'm like, oh, this is like so much better than the blue packet. It doesn't have the aftertaste. It's awesome. It's not awesome. It's bad.
Yeah, and shift work. So police officers, military, nurses, terrible. It's terrible for your gut. I did shift work for a few months. Found myself eating M&Ms all night to stay awake, and Coke and coffee, and almost drove into a center divider one morning, and I'm like, I'm done. I can't do it. I never could adjust.
So more things from toxins. I think I told them this when you weren't here about, why did nurses put alcohol in your skin before they give you a shot to kill the bacteria? Do you really want to be pouring that into these into the city? Really, it's really the population of your protective force. You don't want to do that.
So all of these things that we do, we're not going to live in a perfect, sterile environment. We know that, but you need to do it within balance, and you need to have a plan to protect it and repopulate those bugs, right?
Infections, low omega-3 fatty acids, which is rampant in the population, 90% or more have low omega-3s. All of you should be taking fish oil every day. It'll help your pain, it'll help your nails, it'll help your hair, it doesn't help mine. I learned too late. Low vitamin D. How many of you, since you've been in this class, have actually got your vitamin D level tested? Anybody? All of you should know that number like you know your blood pressure. It's very important. Radiation, chemotherapy, or high intensity exercise. I have scanned world-class athletes, like thousands of them, and my marathon runners have the worst brains because it's too much stress. And I believe there's no suffering in getting well, but when you just think about it. Marathons are named after what? After Marathon Greece, where the Greeks won the war against the Persians, and the kid ran 26.2 miles to Athens and said, we won the war, and then died. That should be a clue that these are not good things. And you know the greatest danger to your microbiome is not from prescribed antibiotics?
It's from food. 70% of the antibiotics in our country are used in our livestock. So that's why we are huge advocates of eating a little less protein, but really high quality grass-fed meats. So free range, grass-fed, higher quality. We tend to eat a lot of low quality protein on the run. We'd rather eat a little less of it and a lot better stuff.
So hormone-free, antibiotic-free, free-range, grass-fed, you're going, but that's expensive.
Being sick.
We would argue, especially after what you've been through with cancer that came back 3 times, being sick is expensive.
Being out of work is expensive.
Yeah, being out
Filing
of
for
work.
bankruptcy is expensive. Dropping out of school is expensive.
And more, I mean, you go to Costco and it says hormone-free,
Yeah.
antibiotic-free. Why do you not want the hormones? Because whatever they give the animals, you get the residue of it.
They did this fascinating study where they gave rats antibiotics, which decreased their gut bacteria, we know that. But when they gave them the antibiotics, it stopped the growth of new cells in their hippocampus. Remember the hippocampus, the seahorse-shaped structure deep in your brain that's involved in mood and memory. And the hippocampus produces 700 new babies every day. So I think of them as baby seahorses. The antibiotics stop the growth of the stem cells in your brain. So, you know, you get a cold, you're like, let me go get antibiotics. Maybe not a good idea as a knee-jerk reaction to do that. Probiotics and exercise would burst the trouble.
So early bonding issues. So if you grew up in a lot of trauma, drama, stress, I had a single mother who was a 16-year-old runaway. So she worked 3 jobs to put food on the table. If you have bonding issues, my dad left. I didn't meet my dad. These bonding, and we have 2 nieces that just moved in with us because my sisters didn't learn. So they just continued that cycle. The drugs and the chaos and they were taken into foster care, and that bond was broken. And so when that happens, those bonding issues, that causes a lot of trouble with your gut, especially in early years. And I was on chronic antibiotics like we just talked about, that increased gut permeability and autoimmunity, which I had thyroid autoimmunity, Hashimoto's, which then became thyroid cancer. We already talked about most of this. My uncle was murdered. But I ended up being one of those frequent flyers in the hospital. So lots of antibiotics, always sick, chronically ill, developed panic attacks when I was 9. But no one ever connected it. So to the fact that my gut was probably trash.
So what increases healthy gut bacteria? So really 2 things, keep it simple. There are prebiotics. These are foods that feed the bugs. And there are probiotics, which are the actual bugs themselves. And so when you think of prebiotics, think of things with non-digestible fiber. So apples, beets, cabbage, psyllium, artichokes, garlic, onions, leeks, asparagus, and root vegetables like sweet potatoes, yams. Now, not loaded with sugar. Why? Squash, echinacea, beets, carrots, turnips.
And so one thing that's not on there is acacia fiber. So I am super busy, like most of you are super busy, with 3 kids in the house and always traveling. So smoothies are my fast food. I just throw a scoop of acacia fiber into my smoothie. It gives me that extra bump of fiber. Most of it, like Americans are chronically deficient in fiber. So you want to be getting about 25 to 30 grams of fiber a day, and that will help you get that fiber. Probiotics, so fermented foods are great, except you want to make sure the fermented foods you're getting are not loaded with sugar. So kimchi, sauerkraut are great. Kombucha, I'm a little iffy on because most of the kombucha, for it to be healthy, most people wouldn't like it, right? It's fine, except that most of the commercial brands are just loaded with sugar. So if you're going to drink it, make sure you get a brand that's not. And there are a couple of brands that aren't. Believe it or not, what is that? 365 has one that is 2 grams, which is okay. That one's not too bad. But most of them have like 11 grams of sugar, so avoid that. But again, supplements are probably the easiest way.
I'll let you.
So I came up with this to basically show our class, when we were doing our class, how easy it is to really just destroy your gut and how our everyday lives, it just happens in everyday life. So this is Larry Leakey. These are the gut wars of Larry Leakey. Larry Leakey goes to work one day and he gets really angry and loses his temper at work and he gets fired. His boss is like, I'm having none of this, you're out. So then he even gets more upset heads to the local bar, and he's like, I just need a drink. I can't handle this. My day sucks. I'm done. So he ties one on, goes home, and apparently he's got a wife like me, and she gets really upset, and it dramatically increases his cortisol level. His stress level goes way up, and disrupts his digestion, and she puts him in the doghouse, and he's like, well, now my life really sucks. I really deserve, like, you know, some sympathy, and no one's giving it to me. So he goes in and he, like, eats a bunch of sweets, and he's feeling sorry for himself, and so the sugar feeds the resistant bacteria, but he doesn't know this. And all of a sudden, like a week later, he's starting to feel a lot of pain, like joint pain, his knees hurt, and his back hurts, and he's not understanding what's going on, but he's just feeling sorry for himself, and life sucks, and he doesn't have a job, and he can't find a job. So he goes in, he takes NSAIDs, he takes Advil for the pain and the headache. That damages his gut further. About a month later, he's sick. He's all of a sudden, he's got the flu. He goes to the doctor. Doctor says, you just have the common cold. He's like, just go home, rest, you know, you'll be fine. And he's like, I did not come down here, pay $100 for you to tell me to go back to bed. Like, you gotta do something. Doctor's like, man, I'm so busy. He writes him a prescription. He's like, fine, here, take this antibiotic, get out of my office. He just wants to get rid of it. So he sends him home for an antibiotic he doesn't need. Takes the antibiotic, goes home, damages his gut further, and of course now, about a month later, he's even in worse shape. Now he's starting to be depressed. He's really not feeling well. So now all this pain, depression. I mean, how many of you know people like this? It starts off with one thing, and pretty soon they're just spiraling. They're out of control.
The psychiatrist gives him Prozac.
I didn't put that word in. And finally, his wife is like, hello, idiot, like, are you ever going to listen to me? Like, let's get this together.
Do you ever say that?
I don't say it out loud. Oh, I told you so. That's my favorite expression, actually. Just can't help myself. So he finally becomes a brain warrior, changes his diet, and gets his act together. But how many of you do that? You do all of those things when you're not feeling well, right? It's just so easy to just head down that rabbit hole.
All right, before we go on to food and food rules and all of that, questions. Are there any questions about your gut? Yes. Or about anything we've talked about?
Okay. If Advil's not good, what can you take when you have a headache?
That's a great question. So if Advil's not good, what can you take when you have a headache?
Well, okay, so first of all, it's not that you can never take it, it's when you take it chronically. Okay? Also, if you're going to take it with food. But if you're taking it chronically, you need to step back and ask, why am I taking it chronically? Why do I need to take this chronically? That's what you need to fix. So in functional medicine, it's always get to the root cause. Why is this happening? So if you're taking it chronically, are you dehydrated? Are you not drinking enough water? Are you not getting enough sleep? We want to get to the root cause. Or is it something deeper? I mean, maybe there's something really going on, and taking Advil is not going to be the answer. It's going to make it worse long term, right? So, but taking it just occasionally for a headache is not going to destroy your gut. It's when you start taking it chronically for headache.
But if you have a lot of headaches, what do I think? I think, are you sensitive to certain foods? So the first thing we do is look at that, and it's like for 2 weeks, see if you can get rid of potentially allergenic foods. And if that doesn't work, it's like, well, have you ever had a headache? Because there's this thing called Irlen, I-R-L-E-N, syndrome, which is a visual processing issue that is very common with headaches. And so anybody who's been in a car accident, who played a contact sport, fell down a flight of stairs, who tends to be light sensitive, they have trouble driving at night, I'm always thinking about Irlen syndrome. And Amelie, our 10-year-old, she had it terribly and nobody knew. They just thought she was bad at sports, but it was really a visual processing problem. She had headaches all the time, and just so much better because she wears color.
Well, her reading went
lenses.
from like barely grade level to like 6th grade level in 4th grade. So, yeah.
Yeah. So the question always is why, and if it's chronic stress, then having a stress management practice like meditation or hypnosis or diaphragmatic breathing.
But you guys are like, your whole job is to ask why and be investigators, right? I mean, that's what you want to constantly be asking why rather than just putting the Band-Aid on all the time. So figure out what's at the root cause.
And there's a brand new study out this morning, I sent it to you, I think, on saffron, the spice saffron, and rheumatoid rheumatoid arthritis, how it dramatically decreased pain compared to placebo, and it also decreased the inflammatory markers like C-reactive protein.
And
that we
any
talked
autoimmune
about
disorder,
before.
that's when you really want to be thinking gluten. Gluten and dairy are the two things you want to like start with in an elimination diet. Get rid of it for a couple weeks, and I guarantee you, you will probably, about 99% chance you're going to start to feel better. So especially with autoimmune disorders.
So every once in a while, Advil, not a big deal, but I have sort of chronic knee pain because I played football when I was in high school.
The sugar's the other thing.
And SAMI, the supplement SAMI, curcumin, because curcumin decreases inflammation, and a good slug of omega-3 fatty acids every day. And staying away from sugar, I have no pain. But I can tell, you know, if I go on vacation or we just loosen up on our diet a bit, I have pain, and it just really irritates me because I know pain. Yes?
What about the baby aspirin that a lot of doctors recommend on a daily basis?
Not so bad. If you're taking the recommended dosage of one, unless you have a reason not to take it because it does thin your blood, so you need to know that it's okay. But I've not heard any reason not to take that if it's good for your heart.
Yeah, be careful with it because it can tear up your gut.
I take it with food.
There's a new study on it. They did this monster study with baby aspirin and found it wasn't as helpful as they thought.
Didn't know that.
Your doctor tells you to do it because you have a higher risk of stroke or heart attack. I would do it, but I'd make sure I'm protecting your gut in
Food.
other ways as well. Any other questions? Yes?
Are there any studies that we can read further on any studies that we can read further on the C-section comics we were making further about ADHD?
On the C-section, yes, there's actually a great book about this called Brain Maker by our friend David Perlman. And, you know, my hyperactive child who was diagnosed with ADHD at the age of 4 is the one that was born by C-section. And so, you know, if I knew then what I know now, I'd have had her on probiotics from birth, pretty much. Yeah.
What's the author's name?
David Perlmutter, Perlmutter.